Doctor on Call comes to you compliments Hills and Valley Pharmacy and the Spice Isle Imaging Center. Good evening once again and welcome to another Doctor on Call. It is Tuesday evening and of course every Tuesday at this time we bring you information that can help improve your wellness. Yes, indeed. We welcome all our viewers on GBN Television 7 and 11, our friends on our Facebook page and YouTube channel, and also our listeners on K105 FM. This evening we're talking men's health and we have two very special guests with us. Well, Dr. Nixon is not with us this evening, but we have Dr. Noel and Dr. Fletcher with us. And as I said, we're discussing men's health. So, gentlemen, get ready. You need to have your television close to you, or if not, your radios, because we have a lot of information to share with you that can actually make a big difference in your lives. And I'm sure all men, although many may not want to accept it, but when it comes to our health, we tend to think that we are superhumans, you know, so we always put things off. Oh, it's just a little headache, I'm tired, or something. And in a lot of cases, it turns out not to be the case. So we're going to fix that this evening. So it's a good time to welcome our guests. And we will start with Dr. Fletcher. Dr. Fletcher, good evening. It is a pleasure to have you. How are you?
Good evening. I am good, thank you. A pleasure to be here.
Yes, indeed. And Dr. Noel, welcome. How are you?
I'm great. Good to be here as well. Looking forward to coming over on Thursday.
Yes, indeed. All right. So I'll tell you what, before we get into a discussion, I'll allow both Dr. Fletcher, yourself, and Dr. Noel to probably just take a minute and just tell us a little bit about you. So we'll start with ladies first. Dr. Fletcher.
All right. And I like that. I like ladies first.
Right. Mm-hmm.
But we're here talking all about men's health, right? So I suppose after now we switch gears and we talk all about the men. But I am, of course, I'm here tonight in the capacity of a physician attached to the Grenada Planned Parenthood Association.
Right.
I am, I'd say on behalf of the association, very happy that we're here having this chat. Very happy to welcome Dr. Noel on Thursday. Very happy to be such an integral part of this initiative. And, you know, outside of our focus on Thursday, I am just really happy about all the work that GPPA is doing. You know, I'll say that in general, very happy to be a part of that, all of the outreach. For a long time, we've focused on women or female sexual and reproductive health. And it's needed, one, but really refreshing. And, you know, the fact that we're switching gears just a little bit. You know, women can still come out on Thursday to have their usual services done, but to not divert the attention, because that's not what we're doing, but to really share the spotlight with men now. I could not say how happy I am to really be a part of this. So Dr. Fletcher, representing the Grenada Planned Parenthood Association, and thrilled to be a part of this.
Yes, indeed. You know, very interesting that you made those comments, because usually when you hear about, you know, Grenada Planned Parenthood Association, you think about that's for women, that's not for men. So it's very interesting that you mentioned that. So Dr. Noel, a minute, tell us a little bit about you and you know what you do.
So I'm Jonathan Noel. My paternal family hails from Grenada. I am really proud to be associated with the GPPA on this visit and reaching out to the Grenadian community. I'm a urologist, so I deal with men's health day in and day out. My specialty focus is on prostate cancer, but by no means limited to that. And I work in London currently, but certainly exploring routes of visiting to the Caribbean more often and perhaps transitioning down in a permanent setting in the future. So, this is an exciting time. I think, this, like Dr. Fletcher said, I think men were previously probably, put in the back of the line, and women were very, brave and coming forward, talking about screening, getting their health awareness at the forefront. And now this is an opportunity for men to come forward as well, because, we all need to care for one another, no matter what gender. So I would look forward to the questions that will follow.
Yeah, yes, indeed. And I do have quite a lot. But before I start with you, Dr. Noel, I want to go back to Dr. Fletcher. I'm hearing that we're looking forward to welcoming you on Thursday. And, some statements that pointing to the fact that something is going to be happening. Dr. Fletcher, can you tell us what's going on? We want to know.
Well, I am going to start by getting a lot of rest on Wednesday night.
Okay.
But on Thursday, we have our men's clinic, and I'm anticipating a very busy day.
Wonderful.
I want to say, more so for Dr. Noel. I am going to be there to assist in any way possible. But I very seriously, I was just being very light, but seriously, we've advertised this men's clinic, and it was posted on different platforms. It was shared. So many persons reached out to me. Doc, what's this? Tell me more about this. But it was, and Dr. Noel would go into even greater detail about what he intends on covering, but just general health. We talk a lot to the men 40, 45 and above, but if you've had an issue for a long time that you've wanted to deal with, from the, difficulty passing urine, erectile dysfunction, something that you might have been trying to deal with on your own, something that you may have seen your doctor about and you have a referral. So we had the poster on different platforms, like I said. We got quite a lot of interest. And persons would be calling, exactly, what are you all doing? What are you all doing? But it was so well received. It really, really was. And we've gotten quite a few appointments. We really do have, last I checked, back-to-back appointments for Thursday. Right. I don't think they're going to let him leave. I don't know how we're going to figure that out yet. But really just covering any men's health issue. Okay. Yeah, come in, sit, have a chat. So we have been advertising this for a little bit, but it is, I must admit, I did not expect the
response that you got.
That's something.
Right, yes.
I did not expect the response that we got, and it says a lot. It really, really does says a lot. It says a lot.
Yes, I'm really happy to hear that. I'm really happy to hear that. And that will be happening at the GPP.
Right.
Yeah.
So Thursday you see, we're at a point now where we were saying walk-ins were available, but we are so booked now. I would encourage persons to still call. If anyone's looking at the program tonight, you can still call tomorrow, see what we may be able to put in place. But what we were alluding to was, like I said, this men's health clinic that was tremendously responded to, so to speak. And that's why I keep saying, I'm going to get a good night's sleep on Wednesday, because I foresee an extremely busy day for us on Thursday, making a difference and coming out and serving the men of Grenada.
Well, I'll tell you what. Our numbers are really high, so you might have to start planning for another one very
That's
soon.
right.
Yeah. But that being said, Dr. Noel, it's over to you, and I think I might have some fast balls I would like to bowl. It's cricket season as well as football, but I've got some balls I want to bowl to you. But I know your
ready. Boys are ready.
All right. So I know your area, urology and so on, but to sort of put things into perspective, when we speak of men's health, so apart from, prostate and maybe sexual health, let's just put that into context. Men's health, what does that really mean?
I mean, that's a great question. I think with regarding, men's health, I think you have to look at it holistically.
Mm-hmm.
There are lots of things that can impact both men and women, but certainly are more predisposed for men. Cortisol, or stress hormone, I like to call it, can really impact men in terms of weight gain and staying weight that's difficult to actually drop. We know for men, when they gain weight, it tends to be around the belly, tends to be around perhaps the chest wall, and that can really be a sign of developing metabolic syndrome. So metabolic syndrome is kind of like a whole collision of high blood pressure, poor blood sugar control, diabetes, and a little bit of extra weight that you're carrying as well. And what's interesting is that high blood pressure, diabetes is not a men's problem, but certainly when you see that with men, you can actually have side effects that the men will start to complain of and bring themselves to the doctor. And usually it's not because of the blood sugar, it's not because of the blood pressure, it's because the erectile function is changed.
Right, yeah.
And that's what brings them to the doctor right away.
Yeah.
But you have to understand that the point in time when the erections are starting to fail is usually a reflection of your overall health.
Mm-hmm.
Of what medication you're on, perhaps, to counteract that health as well, whether you're on blood pressure tablets. If your blood sugar is not controlled, your vessels suffer, and the vessels feed the penile tissue to allow the penis to become erect.
Mm-hmm.
And those are very small vessels. So if those small vessels start to become problematic, imagine the other vessels feed to your brain.
Mm-hmm.
That could be a stroke risk. That feed to your heart. That could be a heart attack risk. So actually, holistically, men actually have the signal that there's a problem going on just by looking downstairs.
Mm-hmm. Mm-hmm.
So I think it's a really important thing. Erectile dysfunction is not to be taken lightly and should be taken quite seriously. We should be looking at the causes of it.
Mm-hmm.
So I like to think of men's health as early warning sign to treat you holistically as a patient. But more often than not, men's health can look at the heart, looking for cancer, which could include prostate, but also could include lung cancer, particularly if smoking is a habit of that particular patient. And we spoke about, obviously, heart disease, diabetes, but I'll probably take a minute to say, although my specialty is around the physical health, there's also an opportunity to speak about mental health. Not my area of expertise,
Mm-hmm.
but certainly something that should be brought to the forefront, and perhaps GPPA and others will be looking forward to that in follow-up clinics as well, because that's a very important area.
Right. Yeah. Excellent. So, and in fact, that's one of the areas I wanted to question you on. But before we get to that, and you spoke of the overall health, the hypertension, the diabetes. Why are men at higher risk, as it relates to these conditions than women?
I think it's multifactorial, but certainly men tend to develop or do habits that put them at risk for these things, whether it's excessive eating of the wrong things. Maybe you're encouraged by your friends together. Oh, you can't eat all that food. I'll eat that food, etc. Drinking, alcohol consumption is very high in Caribbean culture, as you know. And certainly that lends itself to weight gain, to heart disease, and also to erectile dysfunction. But then there's the influence of hormones. I think testosterone as well is one of those things that can put you biologically at risk for certain diseases, notwithstanding prostate as well. We all know that prostate cancer is a disease of the elderly, but it's not limited to the elderly man. It can happen when you're younger, and that's something that's really important that I want to put out there to the public. But testosterone has been linked to developing prostate disease. And now there's a rise in supplements, lots of supplements online. People are buying things online and may not actually know what's in it. And if there's any testosterone supplementation, know that you will be putting yourself potentially at risk for disease acquisition. So you should always discuss with your doctor locally before you start taking things for a long time. So yeah, that's in a nutshell why men are at risk. It's the habits that we do in our life, and we have to actually, make sure we curtail it as well.
Right. I'm happy we're having this discussion because I think our men need to understand, the risk involved and why they're a little more at risk. But why do you think we tend to delay our medical checkups? Rather than something happens, hey, let me have this check, let me make sure I'm safe, let me go to the doctor. No, we don't. I mean, Dr. You've probably seen, hundreds of patients, males. Why?
Yeah, there's no one straight answer, but certainly I think men don't like to admit when they have a problem or they're sick or they need help. They think they should suffer in silence and be the strong breadwinner or the alpha male and not be sick, not be off work, not be held down in hospital, being admitted for one reason or next. So they'll delay. They'll delay coming until the symptoms are perhaps very late or advanced, and that's a shame because at that point your outcome is very different from when someone presents early. So, early presentation, taking control of your health early. Why would you take your car in to get assessed every year to pass the test when you won't even take your own body in to get, checked? I think it's important. We rely on our bodies to keep us through the day and to carry us through life. So they definitely needs to be checked every year as well. So it's a delay factor. But I wouldn't say that for all men. Some men certainly perhaps just feel very scared and inherently to go to the doctor. Maybe there's just other pressing issues such as time off work, etc., because they may be preoccupied. But I think they should be encouraged, and employers should encourage their workers to get checked at least once a year, because a healthy worker means you don't have any downtime for your employees when they're sick,
right? Don't
you? But that's my perspective. I'll be interested to hear if Dr. Fletcher has a view.
Yeah, Dr. Fletcher, at the GPPA, do you see a lot of males coming in, to probably check on whatever issues or the other?
I'm again trying to find all the right words. Listen, I tell you this, I think what I was trying to do was some quick math for you. Because if 100 patients walk in, I'm being generous, 10 of them are males. So we're talking about a tenth. And it really, really is unfortunate. I had a patient recently who said to me that her partner, and we do a lot of STI testing at GPP. So I'm just referencing, I'm using one of those examples. But she'd come in with no symptoms at all. And she said to me that her partner had been having such severe symptoms. I said, hold on, let me make sure I'm understanding. Because he's having the burning on urination and the pain. But he decided to ask you, with no symptoms, to come in to get tested. And I think that is the perfect example. He just refused to come in. And I I'm listening to Dr. Noel, and I mean, I would love to even hear what you think the problem is, because I cannot wrap my head around it. I think there is some fear. As a matter of fact, it's, from what I understand, a fear of there being something serious, and I don't want to know, because what can I do if I know? But like Dr. Noel just said, a lot of the time, if you know something early enough, there's a lot that we can do. So I think it is that, I have to be strong and I can't be sick. I can't have that time off work. And then on the other end, I think it's, you know what? I know something's going on, but I don't need to know what it is. I cannot afford to know what it is. I can't put myself through that. And that's where the mental health may come in. But it is something that I have seen for years. And like we said, a few more men are coming out. I think if we look at the numbers now compared to 5 years ago, we've seen some improvement, but we're still so far from where we need to be. That's the reality. And I really wish men we need to start moving away from, I don't want to know, I'm afraid of finding out. And, we did another little chat, and I was saying we need to stop. We need to put an end to the reactive healthcare and start putting proactive wellness at the forefront. So just like women always did, you come in, you do your screening. It's the breast screening. We do your pap smears for cervical cancer. That as well, men tell you all the time when it comes to the prostate screening and the digital rectal exam, Doc, I'm not coming to do that. No, nothing's supposed to go in there. Things only come out. That kind of thing. So I think there is some stigma as well that we need to work on. But I do agree that it is multifactorial. But I'm happy with the small change that we've seen in the numbers of men coming out, as small as the numbers still remain. And I do hope that we continue to move in that direction. Men really need to come out. It's stronger for you to come out and get your health checked and be aggressive, or as aggressive as need be, so that you're around longer for your family, your friends. I don't think there's any strength in staying away.
We need to I'm wondering if maybe there is something cultural about it, because if you sort of think back, our grandparents and great grandparents, before medicine got where it is today, they would get whatever bush it was and they would boil and drink and all of these things. And this is still very prevalent today. You hear sort of people, they probably get a cancer diagnosis, and they would tell you that they have certain bush that they would drink that would get rid of it. And so I believe there's some aspect of culture involved, and of course men thinking that they are, as Dr. Noel said, superhuman, so they won't accept the fact that they cannot deal with a problem, even if deep within they know there is a serious problem and they know what the consequences could be, but it's just that maybe the male ego is preventing them to not do what they're supposed to do. But I think also maybe one of the things that, and maybe Dr. Fletcher, within the organization can probably try to help with, get men to speak about these things, like man and man talk, rather than discussing other things. Talk about your health. I don't know, maybe it might help.
That's yes, I think we do need to get men talking. And you see, again, Dr. Noel alluded to this, when you come together, as groups of men, as partners, and we engage in the poor habits, right, that cause a lot of these conditions. I think you're right. We need to start, one male would ask his partner, there was a group, actually, a group of young men, and I think they're all 40 this year. And they were discussing going in to do their prostate checks together. That is what we need to be doing.
Yeah.
So instead of the drinking and the smoking and encouraging all the other poor habits, let us start doing that. Let's start being our brother's keeper. And guys, no, listen, we need to do this. Because it may take one or two men, and some of them may say, no, man, you all go ahead. But I think after they realize, everybody else is doing it, and I need to be smart. So you're right. I think there is that cultural aspect. And I always say, we have, and I'm sure Dr. Noel may agree, we've found ways. Patients always ask me, Doc, can I take this medication with this? And they may tell me one or two herbs that they're taking. And that's what's important. Discussing that with your doctor. A lot of the time, there are things that you could take simultaneously. So it's not that we completely shut out or shut down the herbs. The problem with herbs, because a lot of these medications are the same type of herbs, but they're in measured doses and that type of thing. And that's what I tell patients all the time. So it's not that we're against the herbs at all. The issue there, though, is that sometimes you can't say exactly how much of exactly what you're supposed to be taking, and that can have adverse effects. So I want to let persons know, because we practice what we call evidence-based medicine, it's not that we're going to tell you get rid of those herbs entirely. I speak to patients, we see the usefulness in a lot of these herbs. And it's just that conversation. Come into your doctor, sit, discuss. But I will say the herbs alone often cannot do what we need them to do. So we do need to work on that cultural aspect. And like you said, we need to get into groups of friends and have men coming together and being accountable to each other. I think that will make a significant difference.
Yeah, I do believe that. So, Dr. Noel, I'm coming back to you. And earlier you mentioned the aspect of the mental health, stress and emotional well-being. Why do you think men struggle to talk about these things? To talk about, if a man is stressed, and again, we understand the ego thing, but stress and other mental conditions, very, very, very serious. Why do you think men struggle in, talking about these things and sharing it so that they can get help? Is it the same reason as it relates to other aspects of their health?
I think, I suppose being vulnerable, sharing your emotions, sharing how you're feeling is not a very common trait that men have, to the frustration of their female partners, probably. And, you see it time and time again in real life relationships on the television or whatever, the man clams up and tries to internalize a lot of things, and you may laugh at it and say that's just how he is. The female partner may say, well, he bottles up all his emotions, but sometimes that can turn into mental illness as well. When you bottle up things and you don't get things off your chest and speak about it. The thing one has to realize is sometimes the breakthrough of having a man speak about their emotions isn't necessarily all the time with someone who's close to them, isn't necessarily all the time with someone that may be a friend, or may not be sometimes with their general practitioner in the immediate vicinity. Could be a stranger, could be a psychologist, it could be in a group setting, lots of people around, and it could be where something has to be done on a repetitive basis before that iron armor breaks down.
Yeah.
Ching, bang. So I think it's obviously not a specialty psychology, psychiatry that I'm into, but I do know that certainly my interactions with patients who have urological issues, when you have to consult with them, I think there's a moment in time where there's a bit of apprehension to actually share the issues. I'll take, for instance, I see a gentleman about kidney stones. Okay, kidney stones are common. And you go and talk to them for about 10, 15 minutes. And just before they leave the door to exit, when you finish your consultation, you're trying to say, well, doc, I've been having real problems with this or that. That's very personal, because it took 10, 15 minutes for them to feel comfortable to share that time. So then we have to add on another 10 minutes, but that's valuable to them and to me, because at the end of the day, that's where your breakthrough is. So I think GPs, health practitioners, nurses, wives, sisters, friends have to recognize those signals as well. And it's not a manipulation, it is just a process of conversing, and I think that's just how we're built, not to overly share. Some of us do, but most of us try to keep it inside. And you think it's what makes us men. I don't know if it's a hormonal thing. But it's one of the things I find very interesting about men's health as well.
I mean, I understand that, but when it comes to your health, I mean, for me, this is something very, very serious. I don't play with that. I make it my duty, to get myself checked. I love life, so I want to live as long as I can. So I make it my duty. But health is a very, very, very important thing. But how do we get men to build that or to gain that emotional resilience? Understand, look, there is no weakness. Being weak is part of life, but you have to be able to build that kind of resilience and be able to come forward and speak about these things and say what is wrong and present the problem to your physician. How do we get men to build that kind of emotional resilience? What do we need to do? Dr. Fletcher, what do we need to do?
What do we need to do? I think we need a round table on this one, because I talk to men all the time. And like I said, this is through last Thursday before last, I did some outreach in Guelph, but of course with the fisherman's birthday and so on. And I was out there doing some PSA testing. And, I expected to see all the fishermen coming out and getting tested. I do not think I saw one fisherman. And we sat there. I got up to Guelph at about 9:30, and I left Guelph at almost 4:00. And the disappointment, because I really expected, we're celebrating the fishermen, and this health fair is being put on for you. Come out and get tested. And you could imagine the disappointment, my entire ride back to St. George's.
Dr. Fletcher, let me jump in here. let me jump in here. You're talking to fishermen, right?
Right.
Do you know what fish broth does? I mean, come on, think about it. so now you can understand. Now you can understand why they were called. Fish broth is supposed to be, remember what they said, right? Fish broth and the back. So
That's right.
So you should understand why they didn't come out.
With you sooner. Listen, I mean, and again, we're having a little laugh, but what can we do? Because you know what I've always said, we can't sit in clinic and wait for some men. I think there are cases where we need to go out and meet them where they are. I've always said that. I said, let's start by doing that. Let's go out there. Let's in an informal environment, let's chat with them. Let them know the importance of this testing, the importance of certain lifestyle modifications. And we started doing more and more of that. but I still find such difficulty. And I'm going to go out on a limb and say very few practitioners have the answer to that question, because then we would have been seeing a lot more patients, a lot more male patients, and treating a lot more male patients. I don't know. I'm hoping Dr. Noel has something for us, but I really did think getting out there, like I said, last Father's Day at Planned Parenthood, we wanted to do something for the men again. How do we get these men to come out? How do we get them more serious about their health? And, we thought maybe we need a couple coolers of beer, and we could go to the Esplanade Mall and sit there. But of course, here we are talking about beer again. Certainly not what we want to be encouraging, right?
But if it's an icebreaker, you need.
The icebreaker.
Yeah, make it part of an exercise camp, and then finish it off with some beer to cool down.
Right.
Because I think I like your suggestion a lot.
Yes, yeah. And
groups coming together, sports activities, whatever the case is, that's key.
That's where we need to start. Yeah. So it seems like such a simple question, and the answer may be simpler for females and children, but we have really had to brainstorm. How do we reach our men?
But I don't think that's a difficult thing, and I think Dr. Noel mentioned it earlier, and we got to get into it. How do you get a man to understand, or how do you get him to know that what you are presenting or what you want to present to him can improve his performance? And you would see how many men would come out. I can guarantee you all the men in Grenada will come out.
Yeah? Mm-hmm. Then I think, okay, we have, you see, that's why I said we needed a round table.
There is the myth about it. And I'm sure Dr. Noel can relate to it.
Right.
Men will visit the doctor,
right?
Not when the blood pressure is up or the blood sugar is up, but when something is down. That's when they go to the doctor. Dr. Noel?
Right.
Absolutely. That brings them to the doctor very quickly. And then, it's the management strategy behind that as well. And taking the opportunity to intervene, to address that problem that's got them to present, but deal with the other problems that we spoke about at the beginning at the same time. Don't forget that usually is a reflection of something else going on higher up that could be at risk.
But I think here I am asking the question, so I can appreciate that. Are we accepting then? And we don't want to, but how do we get them in even before something is done? How do we get them to appreciate the screening and the preventive care? Even before we start.
I think that's key, screening. But I think yearly medical checks, just clean bill of health, a check is probably the way to look at it, to mandate that's something that perhaps will not only keep you in good stead as you get older, but it's kind of mandated because you want your employee, you want your citizens to lead healthy lives, because it's less burden on them personally, less burden on society, family, economically. There's lots of benefits to having a very healthy lifestyle and country. And I think Western, obviously, diet and everything, to which I enjoy. I'm not standing here saying that I don't enjoy, food like the next person, but certainly there is the ease of getting food that is not healthy and contributes to weight gain, hypertension, and diabetes. And that is easier to retrieve than it is the healthy alternatives.
That's true.
And I think intervening from an early age, I see nothing frustrates me more than to see school kids diving into a whole box of fried food on every day of the week, when they should be eating other stuff and sweet drinks, so they have kind of that taste for sugar and they prefer the sugary stuff. And anything that's plain is like, well, that's nothing,
Yeah.
And that transfers to adult habits.
Correct.
It's very hard to break at that stage. So I agree with you. And I don't call it screening. I just call it leading healthy lives and intervening at an early stage.
Yeah.
I think two things, just from listening to Dr. Noel as well, but very good point. This needs to start early. And I want to commend here his Ministry of Health and Education have screened the school age. So they do the grade ones and the form ones. And that really does allow, so it's a great initiative, and it allows for us to catch obese patients. We look at vision, for instance. There may be underlying conditions that cause high blood pressure in very young patients. So I'm listening to Dr. Noel and I'm thinking, okay, well, that is in place. I can probably mention that. So we try to start them off on the right foot. But I think, like he mentioned as well, really focusing on the business places. So this is us indirectly trying to get those men out. Because like we said, once we show the company that you need your employees in the best of health to have greatest production or greatest productivity, and it is in your best interest as well that you're encouraging these health checks, I think that might be a game changer as well. So it's something that started early and continues throughout the work life, instead of leaving this to the men wholly and solely. But like we said, of course, still asking the men to do their part in keeping each other accountable. So we may have to target this from different angles. And like I was suggesting, it may not be the easiest task. This is something that we've dealt with for years. So I think it's multifactorial, and we do need to hit it from different angles.
Yeah. Yes, indeed.
Yeah.
So, Dr. Noel, I want to move on now to, I think, what most men will be interested in, and then we'd come on to prostate and some other areas, of the urology. Erectile dysfunction. Let's be going straight to that. What is erectile dysfunction? How is it caused, and can it be fixed?
Great question. So erectile dysfunction is usually a persistent or recurrent inability to actually maintain rigidity or erection of the penis in order to engage in intercourse. And it's quite common. One should know that it affects millions of men. And it's particularly linked to physical health, which we spoke about, such as high blood pressure, diabetes. And I harp on these things because they're so common.
Yeah. Okay.
High blood pressure and diabetes. And, lots of patients coming through the door with erectile dysfunction who perhaps wonder why it's happened. And then they're on 5 or 10 medications that could possibly cause it in itself. So if one was to perhaps address the high blood pressure, diabetes, the diet, exercise, working with your doctor to decrease the doses and hopefully eliminating those medications in your life because you don't need them anymore, suddenly the erectile function can recover. But there's no doubt about it. It's a cause is usually the vessels, the blood vessels that allow the tissue to become erect and turgid. They can be blocked for different reasons, and usually atherosclerosis, as you know, which is a little narrowing in the vessel due to high cholesterol, is the cause. But I will say that things like mental health can impact erectile dysfunction as well. Stress, whether it's work, whether it's social in your life, with relationships, etc., depression, or even just performance anxiety, because society puts some expectation perhaps to have this preconceived notion of what a relationship should look like. And I think that's where conversations have to happen, and guidance from, your partners and your relatives, etc. So, I think it's very common, maybe not spoken about because there's some embarrassment associated with it, but one should speak about it because it could be a marker to intervening early on some things that really need to be intervened on. Would you like me to go into treatments?
Yes, how was it treated? And because I think it's important, for our men to understand that, of course, one, how to prevent themselves from getting there, and if perchance you get there, how we can get out of it.
So the immediate benefits is usually losing weight, physical activity. They say half an hour of running or some cardiovascular activity every day is likened to taking a blue pill, a Viagra pill, to actually have erectile function returned. You can save yourself perhaps the expense of buying the pill and go and do some exercise instead, because that boosts your testosterone. Quitting smoking if you smoke, losing weight, because weight carries a hormone called estrogen, and in men that competes for testosterone, and testosterone is what allows us to have that manly feeling. And if you are lowering that and replacing it with fat cells full of estrogen, then certainly you're not going to be on to healthy erectile function. But then if you've tried all these things and still it persists, it may be a sign that you really need to intervene with medication. And the most common one that everyone knows is Viagra, or sildenafil it's called. There's also some other medications that are like that. And how they work is they allow the blood vessels to open up, to allow blood to flow into the organ better. And you usually take them in the prescribed modality. Don't double up on it without talking to your doctor. Very, very, very important, because it dilates your vessels, but it can also dilate vessels everywhere else. So most common side effects of Viagra is a headache or a stuffy nose. And then if you're doubling it up for performance reasons, believe me, you may get some other problems as well that you don't want to face. So those are medications in tablet form. There's also medications in topical forms or injectable forms that can be used. But also, I think it's really important that before we even get down to the treatment is that you assess the patient for any other problems, such as hormonal problems. Are they low on testosterone? Are they having problems with other hormones, such as the thyroid gland that sits on the neck? That is a really important hormone and could perhaps signal why a patient is depressed and having erectile dysfunction, because their thyroid hormone isn't working well. So I think when someone has erectile dysfunction, I usually recommend a whole host of screening tests, because it would be very silly to just throw Viagra at them and not actually get to the root cause of it.
Okay. What about What about aging and erectile dysfunction?
Yeah, when one ages, certainly the testosterone and the tissue sensitivity changes. The testosterone lowers as we get older. Normal part of aging, similar to females also, your hormone supply decreases as you age. Estrogen and progesterone, and that's why you get some changes in mood. That's why you get into menopause for females, but for men, it can take impact in terms of perhaps loss of interest in intercourse and erectile dysfunction. However, again, I liken that to the fact that the more you do exercise, healthier your blood flow down to the organ of concern, but also the healthier blood cycling to the heart and the brain and the lungs, it's better for you overall. So we've got some patients perhaps who are in their 80s who will swim, who will do some exercise every day on the beach. And you could, probably I would bet that perhaps they're so healthy cardiovascularly in their heart that they actually probably will have healthy erections as well, even at the age of 80 plus. Mm-hmm. Certainly you can see the opposite, someone who's perhaps 40 or 50, who may be having other medical issues like high blood pressure, diabetes, they will be presenting with erectile dysfunction. So, there's not a question as to what causes it, it's how we can actually manage it. I think most people will know the cause by the time it's become a problem. They just don't want to really face the truth.
Mm-hmm, mm-hmm. So we know testosterone is involved. Can a patient come in and, Dr. Noel, I'd like to have my testosterone levels checked to see where I'm at, and, can that be done?
Yes, I think that's an important starting point and consideration. If the lab can offer testosterone for patients, and usually it should be done in the morning because that's when it peaks. You probably would have, heard the expression "morning glory." It's not out of fun that they mentioned that. It's because your testosterone peaks in the morning and the erections happen in the morning. And in fact, when that happens, a patient should actually be very happy that their testosterone is probably in the normal level if it does happen naturally. So you check that. Usually in the morning, you'll check other hormone levels as well that complement testosterone function. And you would make a decision as to whether that patient has hypogonadism or their testosterone just is low and they need to be given testosterone supplementation. But certainly you should not be receiving testosterone tablets, creams, patches without knowing what your testosterone level is. That is not good practice, because if I give you testosterone, your testosterone level is already high, then you will have some problems in the future.
Okay. And what sort of lifestyle factors can actually influence that? In other words, that would support healthy testosterone levels. Well, we know exercise can definitely help with your blood flow, but in terms of your testosterone levels, what sort of lifestyle factors you think can actually help support that?
I think, there's certain foods that we can eat that support testosterone production. We call them healthy fats. Mm-hmm. Obviously, in the Caribbean, we are blessed with lots of fresh seafood. And I think you should really capitalize on having the fatty fish components, omega-3 fatty acids found in mackerel, tuna. These are very excellent sources. Avocado, pear, these are the ones as well that you can have. They're high in fat and actually support healthy hearts, which again translates to healthy erectile function. There's this, certain oils, particularly people like olive oil if you enjoy that. But nuts and seeds are also really good as well. Nuts and seeds, they promote healthy testosterone, and making sure you eat lots of onion and garlic as well. They're natural and they can boost testosterone, and they add very, very nice flavor to most foods anyway. Mm-hmm. So enjoying these things hopefully will help you to have healthy testosterone levels.
Okay, lovely. Now, most men, working men, tend to have a tight schedule, with work, busy here, there, moving up and down. In a lot of instances, that can result in bad eating habits. and it can also, and you mentioned earlier, it can also affect, how men, see their physician to get themselves checked and all of that. In terms of the eating habits, what would you recommend for, or how would you advise men to ensure that they eat properly, even within their tight schedule? Or why is it important that they need to do so?
I think that's a great question, and you hit the nail on the head. Short lunch breaks, eat something fast. Usually it's going to be something you buy from a store that's processed and easy in a package that you can just tear open, eat, and off you go to work. That's probably going to be the worst case scenario for actually being able to have a healthy diet. So what would you do? There are different strategies. You can either meal prep, prepare, very large quantities of meal that you can have and take to work with you Monday to Thursday, and perhaps Friday just enjoy the quick usual lunch. Lots of people do that. Eat healthy breakfast. Probably it would be my recommendation, so that you're not as hungry to have a very large lunch, and maybe you can have something that's small that you can prepare easy, like eggs, maybe some chicken, etc., that you can rewarm as a sandwich. But I think if you can make your own food the night before or the weekend of, it's probably going to have a lot more healthier content than when you purchase over the counter, unfortunately, because over the counter will have higher salt content because it has to be preserved, and more often than not will not contain a lot of the nutrients that your body needs. So that's a lifestyle choice and a lifestyle challenge, and one size definitely won't fit all. But certainly, I would challenge people to actually look at how they can eat better. And realize that, protein is very good for testosterone, but certainly the right kind of protein. You don't want to be having too much protein with lots of fat. You want to have lean beef, chicken, etc. Take the skin off when you can, if you're inclined to. These are the things that perhaps will help you absorb the healthier fat and leave off the unhealthy fat.
Right, wonderful. So Dr. Fletcher, let me ask you this, because I have to go back to Dr. Noel so we can speak a little bit about prostate health, which is very, very important. We couldn't speak of men's health and not touch prostate. So, Dr. Fletcher, as a woman yourself, why is it important that the female gender encourage the male gender to take more interest in their health? And are you doing enough? And when I say are you, I mean the female gender. Are you doing enough? Understanding very well how reluctant we are when it comes to health. Are you doing enough to ensure that we take care of ourselves?
Well, we are not. And I thought of that after I said men need to be accountable to each other. Mm-hmm. I thought, I should have added that mothers, sisters, daughters, wives, girlfriends, we need to do a little bit more as well. Now, I think persons listening on the program might say, listen, he's a grown man. And that's true. He is. But these are the grown men who love and protect us. And we can appreciate that they are a little bit more stubborn than we'd like. But like we're appreciating, this is so deep rooted. Yeah, I think that if we all came together, and not just family, friends, loved ones, but as physicians, yeah. So I know that if I have 2 patients male and female, I need to do a little bit more. No, I don't want to say coerce, but I need to do a little bit more work when it comes to getting that male into the office. I need to, or we rather need to move away from, I told him as, let's say, wife, I told him go to the doctor once and he refused. So I left it alone. No, you don't want to nag at the same time, but reminding him, darling, it really is important that you take care of your health. I want you here for the family. I want you here for all of your loved ones. And I think we may see greater impact.
Yeah.
I might have to remind my female patient that she has her PAP due next week. I might have to call my male patient 2 or 3 times to say, it's time to come in for your digital rectal exam.
Right.
So I think we may need to move away from he's an adult, he should know better, and say, you know what, this did not start with him. And I think I could do a little bit more because I love and care for this person. This is my dad, and I want my dad to be around for as long as he possibly could be. This is my brother, who I love and care for. And you know what? I'm going to hold him accountable. So I think to answer your question, no. Again, I don't know if Dr. Noel would agree. No, we're not doing. Especially here, I think, Dr. Noel can speak of the contrast as well with what he sees and what maybe he will see, with his move back and so on. But I think we do need to do more as a community, and push our men just a little bit harder, push them a little bit further further, but closer to better health, if that makes sense.
Right.
I think I'm going to start advocating for that. I'm going to have to get more persons on board, but let's do what we need to do.
Do you think earlier you mentioned that you were doing some outreach? Do you think it might also be a good idea to maybe go out into the communities and meet the men? Rather than, trying to get them to come in, go out and meet them, and they probably might think, they're really interested in us. So the fact that they're coming out, maybe I really need to start looking at things differently.
That's right. I do agree. And, I think one outreach may not be very successful. And it's easy to say, you know what, they're not coming out. But that is where, like I was just saying, let's go again. Yeah? So the same way your uncle did not go to that first appointment, you push him again. You can get another appointment. How about you try for next week, Saturday, the Saturday after that? So the same way, I may have been a little disheartened not seeing all of my fishermen, but you've cleared that up for me, huh? So despite being slightly disheartened, I'm going to try again. And I'm going to go out there. I'm hoping they're looking at the program and they say, oh man, no, we can't do that to Doc again. And they come out in their numbers. But that is important, going out to meet them where they are, because the reality is they're not coming in the numbers that we want them to. Meeting them where they are, and I am really asking others in the community, others in the home, to keep encouraging them to do what they need to do to be healthy.
Yes, indeed. Yeah. So, Dr. Noel, before we sort of delve into the prostate, Dishon, who is now 24, his mom says that she last saw you when Dishon was a baby, and she's really happy to see you. You're Dishon's godfather, and so she's really excited seeing you on the program tonight. So I needed to pass that on to you, Doc.
Thank you very much. I hope to see him socially on Thursday.
Yes, indeed. So Doc, prostate. It is, one of the most common things in men. When should a man start checking for prostate? We know it's a sort of slow progressing condition, but it starts somewhere. What's the starting point for us?
You'll probably get different answers depending on who you speak to, because there's no unified Caribbean guideline. I'll say that. From my point of view, if you have a family history, first degree relative in your father, your brother, or a history of breast cancer in the females of your family, then having that blood test called prostate specific antigen, which is PSA, should in my mind start from the age of 40.
Right.
And if it is lower than 1.5, leave it alone for about 2 to 5 years and get it checked again. You know, but knowing your baseline is a good thing.
Okay.
You know, I know mine. What's your number? I say that to all the men. What's your number?
Very, very important. Dr. Fletcher did mention earlier that we have a thing with that digital examination. And so how do we change that and get our men to understand, look, this is very important. It needs to be done. Get this myth out of your mind. Whatever you have in your mind, get it out. This is important. Let's get it done. Or else it can have consequences. Or it will have consequences down the line. How do we really get through our men and get them to understand?
So I understand the aversion to it. I'm not, standing here being silly. It's something that is not a, comfortable procedure. Certainly similar to having a colon telescope, colonoscopy, similar to having a scope down your stomach for a stomach problem, similar to having a tube put down your ear or looking in your eye. These are things that shouldn't happen, as someone said to me once. Yes, something shouldn't go up the back passage and go in through all the other orifices, but we do it for a medical reason. We do it for medical reason to find out what's happening so that we can help you for the future and find things that, would properly present a bit later. It's interesting that we're on a crossroad now, and I suppose that's the interaction of urology or prostate practice in different parts of the world. So we're trying to move away from the digital rectal exam or the finger examination in some countries and replace it with a scan instead, because they find that scan is a lot more accepting from patients. They're not as fearful. So we have to be very careful that we're not going to stand there with, the examination being the default and drive away lots of potential men. So it's the men that usually come to the community events. It's the men that usually come to these pop-up clinics. Most times they are serious and they want to engage. It's the ones I worry about, the ones that don't show up.
Right.
It's the ones that don't show up. What are we missing? And perhaps that's a project for a young budding doctor or student to look at. What are the attitudes of these patients or community members who are not showing up to clinic? What is it? What are we missing? So one of the things is this examination drives away people. And, the middle ground would be to have an affordable alternative in terms of a scan, to scan the entire prostate without having something internal go into the patient. In the UK, where I practice currently, we're very fortunate to have an MRI scan, which is probably about 500 EC for every patient that comes through the public sector. And that's a big ask for an organization. But anyone who has a prostate blood test, which is very high, will get the MRI scan. No questions asked. Myself and other colleagues in the region ask ourselves how we can roll that out in the Caribbean. because if we can get that to a more affordable price point and use a threshold of that blood test to invite men to have it, I think we'll capture a lot more potential diseases earlier. So that still remains a challenge, but not insurmountable. I do not believe it's something that is in the future, decades ahead. I think it's in the future, perhaps within the next 5 years. Because if that will bring more men to feel emboldened and empowered to have a blood test only, PSA, and then if it's high, we proceed to a scan, that perhaps will open up the door a little bit wider and people will feel a bit more inclined to come forward. And that's a good thing. And that's worth it in the end.
Yes, indeed. So as it relates to prostate, what signs should, or what prostate signs should men not ignore or not take for granted?
I like the way you phrased that, because I thought you were going to ask me what are the signs or symptoms of prostate cancer. Because when it's early, there are none.
Right.
There are none, there are none, there are none. If you're waiting for signs and symptoms, you're probably waiting for it to become advanced. Hence, knowing your number. What are the signs and symptoms that you should not ignore? Blood in the urine.
Right.
You see blood in the urine, don't ignore it. You're going very frequently, urgently to the toilet. You're not emptying well. Something's going on. And it doesn't signify that it could be cancer. I don't think people should correlate that with cancer. You should correlate it with maybe something's going on in the bladder. Maybe something's going on in the water pipe. Maybe something's going on in the prostate. But you should allow a urologist to make interpretation, and you should come forward. So those are the major symptoms. If you're getting into symptoms like pains in the back, in the bones, that's quite advanced disease when it starts to spread. That's usually pain that is unrelenting at nighttime in particular, not related to movement like exercise. That's usually just muscle aches and pains. But nighttime pain or nighttime pain in the back, and you're not having trouble passing water, or you're actually leaking urine, that's a sign you should get seen sooner rather than later.
Right. Doc, is there a difference between having an enlarged prostate and prostate cancer?
No, they both can happen independent of each other. They both can happen together.
Okay.
One doesn't predict another. You can have a very large prostate gland that's benign and that makes a lot of PSA. So your number may be very high. And then when we do the scan, they say, oh, it's just a large prostate.
Right. Okay. Because I think people just use it loosely. And some people really don't know the difference.
Yeah, so it can be very challenging to pick up unless you have seen a urologist who's done an assessment and made some investigation. Otherwise, you are doing your best at making an educated clinical judgment or guess, and I think you should really come forward and have the diagnosis be made. So if you have a benign, non-cancerous big prostate, you will have urinary stoppage of water and flow problems, and we know that, and there's help afforded to you for that. But certainly, like I said earlier, if it's cancer, when it's early stage, you could have nothing. You're just living life just fine. And if it's late stage, you have different symptoms entirely.
Right. So if men who are listening to the program, we're addressing the men who are listening, Doc. They're listening to us, listening to the discussion, and they're probably asking themselves, what's the hardest part of me taking care of my health? What is probably the most difficult part for me to handle as it relates to my health. Understanding very well the reluctance in men.
I suppose the difficult part is actually facing the potential that something might be, might need treatment, might need management. But you've got to know that we are all here on God's time, and, no one is going to be immortal. But that doesn't mean that we just leave it to chance. We have medical intervention, and we can help, hopefully reverse things. High blood pressure, diabetes, when acted upon early, can be reversible. Obviously, the non-communicable diseases, or NCDs, is on the rise and a real problem across every Caribbean island. And if we don't seek to address non-communicable diseases, which include cancer, then we're going to have a real problem with a healthy aging population that lives quite a long time now because of the miracles of medicine. We want our aging population to live good, fulfilling lives in their latter years with healthy quality of life.
Mm-hmm.
So I think the difficulty of facing for men is, yes, that downtime, but, if it's downtime because you're addressing your health, I think it's time well spent for the future.
Right. And as it relates to, just maybe extend a little bit on that, in terms of medical procedures, because there's also that fear. So apart from being fearful that you go to the physician and you might hear something is wrong, then there is the addition to that there might be a medical procedure involved. You may have to probably remove something or fix something or whatever it is. So that's an additional fear. How would you, as a urologist, and we're talking, that area of care now, how would you, as a urologist, sort of reassure your patient that, look, I understand how you feel, but look, there might be more sense in trusting me and trusting my judgment so we can get this done to get you back where you're supposed to be? How would you deal with it? How would you address that?
I think you started to, very nicely. In fact, if I was a patient and I heard you speak like that to me, I'd be very reassured, which is, we want to get you back to functioning normal. Trust me in the process.
Mm-hmm.
This is a diagnosis procedure to find out what's happening, and it may actually be coupled with a treatment procedure at the same time. There's no shying away from it. It's uncomfortable. It's a very sensitive area in the male reproductive system. The penile, urethra, the bladder, prostate, even the kidney for male and female can be very painful when it's instrumented with medical devices.
Mm-hmm.
But certainly, if you can deal with issues before they become problematic, and let's talk about it very simply, if I can perhaps do a biopsy of the prostate because I think there's an early stage tumor on one side of the prostate, that is uncomfortable, but can actually help you determine whether this is something that we can treat with surgery early versus leaving it to start to fester and become a potential problem where we can't do surgery and all that is left is for us to operate with removing your testosterone source, which is usually the testicles, unfortunately.
Right. So, Dr. Fletcher, I'm coming back to you, and it's probably, my final question to you, and then we're going to come to Dr. Noel, and then we will wrap because we're almost out of time. Sexually transmitted diseases. Men and STDs don't go well. They would try to maybe course a pharmacist to work some kind of miracle where you don't have to go by the doctor and all of that. Let's talk about that from the perspective of the GPPA.
Well, like we mentioned earlier, so many men are now in the habit of sending a girlfriend, to test. And, well, whatever she's having, ensure that you get a prescription for two. So you're absolutely right. They will find a loophole. But I have, like I said, looking at numbers, because I work with these statistics, I pull the statistics monthly together, and we have seen a slight increase in the males. But again, I mean, it is a fraction compared to the women who come in for testing. I think that must be wholly and solely fair, because it's a case where when I do sit with these men, they mention certain habits that would put them at risk. But doc, I think I might be positive for that, So it is that fear where I don't want to hear I have this, of course, especially if we're talking about something incurable.
Right.
So we have, of course, HIV, which we have mentioned. Our numbers should not be what they are. Yeah, quite simply put. Things like herpes and so on. So we know these are incurable, all of the viruses. The gonorrhea and the chlamydia, I think there's still that degree of fear, because now, doc, I know these are curable, but I've heard that sometimes in the case of injections, I've heard that it's painful and so on. So I say, again, to answer your question without digressing too much, there is still a fraction of the men coming out to test comparatively. And those who do come out tell you, doc, I'm here, but I'm really afraid to do this test. And it goes back to what we were discussing earlier, because we remain in fear, or our male patients remain in fear, and we shy away from the testing that could, in some cases, save our lives, or early testing certainly decrease the adverse effects, the long-term complications that we otherwise see when we sit on something. So it's a huge problem, and we keep seeing a rise in STIs because condom use, I think, is a lot lower than it has been in the past, a lot lower than we want it to be. So we are seeing a lot more STIs, but not the equivalent, or not the number of men testing don't match what we should be seeing, so to speak. But I talk to the women. I talk to the women all the time, and I tell them, well, I'm happy that you're coming to get tested. But the reality is, a lot of our male patients have multiple partners, and we need them to come out to test. So can you encourage him? Which is tying in with what we just discussed. So instead of women saying, all right, I'll go test, encourage him to come out to test. We really need to ask them to remain accountable to themselves, to us, go out and get tested. Because like I said, we are seeing a lot of STIs, unfortunately. And the number of men we should be testing, we're not.
Do you think, Doc, it could be a case where maybe they want to come, but and yes, it's the fear, but the fear that people might get to know?
Yes, Yes, I think that's a very good point. So it is a fear of knowing themselves. But yes, because you know what? I have to sit with that doctor. And, when I take a sexual history, and I'm sure Dr. Noel does the same thing, but I ask you about number of partners. I ask certainly male, female, both, because that helps us. And I think, that sort of causes me to mention, again, the discrimination. So I think, too, not just men in general, but we're not seeing a lot of persons from the LGBTQ community. And I mean, this is just an add-on to the rest of the conversation, because there is that, like we said, I don't want to know, but the fear of discrimination. So specifically speaking to that community, I have had persons tell me, I don't want to go to certain testing centers because there is that fear that, it may be the secretary at the front, it may be the nurse.
Yeah.
But if I say these are my habits, I'll be judged.
Yeah.
So I think you hit the nail on the head with that as well. And probably more the fear of judgment, whether it's a straight patient, whether it's someone from the community, but that judgment more than I'm afraid of that positive.
Right.
Or in some cases equal. But yes, yeah. So we're talking about the root here being fair, but now we're seeing that different things may be causing that fear. But this is something that I have addressed a lot. I mean, apart from our heterosexual patients, I speak to persons in the community all the time, just trying to encourage them to come out. But sometimes I sit with them and they say, Doc, you wouldn't believe the discrimination that I was faced with elsewhere. And that is something that we need to work on. And I think once we do that, it's reassuring that person that this is confidential, there's no judgment in here. And, it's like, again, Dr. Noel mentioned this, sometimes at the end of the encounter, they're about to walk out the door, someone else needs to come in. And they say, you know what, Doc, I want to be honest, I have 3 or 4 partners. And because that is when they felt, all right, she may not judge me. And I feel comfortable telling her that now, because that changes everything. Now it's almost like COVID, we're contact tracing. Now more persons need to get tested, but he's reassured that I didn't judge him for that last statement. So yeah, I think that does have a huge part to play. And I think as testers and testing centers, this is something that we need to remain cognizant of, because once we change that, we may see the men coming in slowly but surely.
Yeah. Yes, indeed. All right. So, Dr. Noel, final questions, and we're going to wrap. I have three questions. Very short answers, not essay type. Short answers. So, one health habit that every man should start today.
"15 minutes of medium to vigorous exercise every other day."
Right. Question 2. One screening test that a man should never miss.
BSA.
All right. And finally, one lifestyle change that would add to a man's life.
Alcohol in moderation.
Dr. Noel, thank you very much. Dr. Fletcher, I thank you all so very much for coming on and having that discussion with us this evening. It was such a pleasure. So I'll give you both 30 seconds. Closing remarks. Dr. Fletcher?
All right. Well, again, I want to thank you for having us. And I think a lot of my answers were essay type. That was for me. But thank you so much for having
it was on purpose.
But I could not have been happier to be here. Thank you so much. I am very excited to work with Dr. Noel on Thursday. Very excited to serve. And like we said, I think I'll have to reach out to you to let you know when some of the outreach is, so you can
definitely.
You can probably help me get those men out.
Oh, sure, definitely. I'd love to. Not a problem at all. Not a problem at all. Yes.
All right.
Dr. Noel, your closing remarks?
Well, thank you. Muchas gracias. I wish Mexico and Ecuador all the best of luck in the upcoming game. And I look forward to seeing you on Thursday, everyone. Good night, Grenada.
Yes, thank you all very much, Dr. Noel. Thank you, Dr. Fletcher. Thank you very much, and continue the work that you're doing. And I hope to have you guys on the program not too long from now. All the best. Have a good night. Yes.
Alrighty, night.
Yes, indeed. Okay, folks, that's all the time we have this evening on the program. Thank you for staying with us. I hope there's at least one thing you can take with you from this program. So until next Tuesday, do have a good evening. All the best.